because of pain. I feel like less of a partner, especially in the last couple of months. I had to give up sex. There's no possible way anymore. Not even for like a few seconds anymore. Whatever's happened in my hip, it's pretty destroyed. And I'm going to have to keep paying for that.
Hello, welcome to another amazing episode of Bunny Hugs and Mental Health, a free safe space for people to share and learn from others' experiences with mental health and addictions. I'm Todd Rennebaum, suicide attempt survivor and a recovering substance abuser. Welcome to another episode. So this week's episode, I'm speaking with Angela Hartlin, and if you've been listening to the podcast, I actually spoke with her a couple years back, October 2022, about skin picking. Well, not just skin picking, actually, it's called body focus repetitive behavior. So that could be anything from picking to pulling hair to picking your nose to scratching yourself to the point that you're causing blisters and things. So anyway, she's a huge advocate of that. But this time we are going to be talking to her about chronic pain and how that affects mental health. She's been living with chronic pain for over 10 years, and she's having trouble with the health system in her province of Nova Scotia, so she's going to talk about that as well. And hey, if you like the podcast, if you've been listening for a while, if you haven't rated and reviewed the podcast, please do so. There's been a lull of that lately, and I'm telling you, it's one of the best things you can do to help a podcast. Any podcast that you're listening to, rate it and review it, and it does amazing things for that podcast, and it helps people find the podcast that could really benefit from it. And in the show notes, I got all types of links and things if you want to buy me a coffee or you want to buy some kind of merchandise from the podcast. That's all there too. If you just want to send an email and say hello, you can do that as well. Or if you'd like me to speak at an event for your school or work or community group, you can do that as well. You can send an email at bunnyhugspodcast@gmail.com. I can do it in person or virtually, pre-recorded, whatever. And please, if you like the podcast, I think you'd like the YouTube channel as well, Bunny Hugs and Mental Health, and you can watch these interviews. I'm really close to getting monetized on there, so yeah. Just subscribe and watch a few videos for a little bit. That'd be great. Anyway, back to this week's episode with Angela. So without further ado, I give you Angela Hartlin.
In 2012, I started having pains mostly on my left side, and I didn't quite understand. I thought it was a flare-up of normal pains that I would usually get. In my back or my hip area. So I waited and they didn't go away. And then I later found out it was probably from a fall when I was employed that summer in 2012 that it happened. But when I first went to my doctor at the end of the year, because I did wait a few months because like, oh, maybe this will get better. And I went to my doctor and he said that it takes like 2 years to get into the pain clinic or orthopedic surgeon. So he wasn't going to put me on the waiting list. It's like, okay, like that's going to do anything. He tried some freehand cortisone shots that didn't work at all.
Sorry, this is in Nova Scotia?
Yes, this is Nova Scotia in Canada. So when I switched GPs, which took about a year, and then she made those referrals, which did take 2 years each, almost on the dot, I remember. And one of them gave me nerve blocks into my left SI joint, which kind of numbed the area a bit, but it didn't get rid of the pain altogether. And I was diagnosed by the pain doctor with piriformis syndrome. So I hadn't heard of that before, and I went online to find out what it was, and I actually didn't think I had it because I didn't have pain running down my leg at the time. But generally, piriformis syndrome is when your piriformis muscle compresses against your sciatic nerve, and it results in inflammation. And I've heard it described in forums as sciatica on steroids. But with what actually happened to me, is I had to wait until 2018 when my right side ripped with compensation, my right hip, from having to drag my leg around so much that I had to go to the States to get it fixed. Because it was the only place that did piriformis removals. I think there actually may be a place in the UK now, a couple doctors, but it was done by a peripheral nerve surgeon, whereas orthopedic surgeons couldn't do anything here, and the pain doctor. But I certainly got a lot of comments about how the pain could be, in my head. Maybe I've been in pain for so long that I'm desensitized, or it's psychological. And it almost got to a point where I was even questioning, is this in my head? And maybe I am just really, but I was like, no, there's no way, because it was just so focused on one area. And that was my left butt cheek. So I couldn't sit down properly. I couldn't it was so hard to lift up my leg to walk. So I was basically dragging it around. And what I ended up finding out when I went to the States, which there's a video online on my YouTube channel. I tried putting on TikTok, but they they gave me a strike, so I had to remove it. What happened was my piriformis muscle had lodged into my sciatic nerve, and then there was 6 years of scar tissue building up, and I believe it was veins. It was either veins or arteries that started wrapping around one of the other sciatic nerves. I think the proximal sciatic nerve. I have that written down somewhere, but it was generally, I had scar tissue, it was pushing it was lodged in. And so when the piriformis muscle was removed, the sciatic nerve itself was actually deformed. So it took weeks for that to decompress and go almost back to normal, even though it's hard to lie on my left side. But now I have no choice but to lie on my left side. So in 2018, I was in a really, really dark place, because I couldn't even sit in a wheelchair if I wanted to, because when I ripped my right hip, I was actually it was probably January of 2018. It was January or February. But I had been having pains in my right hip a couple months prior. I got x-rays, showed nothing. So when I ripped that side, I ended up going to seeing an orthopedic surgeon, and eventually learning that I had something called femoroacetabular impingement, FAI, and that I could get surgery for it. I was gonna wait, but I had also, right after my piriformis removal, was so into just wanting to get my life moving forward that me and my husband tried for a child, and we knew it would only be one, because my body was not good. My piriformis stuff was better, but my right hip was not getting better. And so when I got pregnant, unfortunately I lost one the first time. I got pregnant exactly 3 months after the surgery. So I would have given birth on the 1-year anniversary of my surgery, but unfortunately I had this dystopian 28-day miscarriage in December of 2018, which is a whole story of its own. I ended up getting pregnant, and I was sick the entire time. I had a taste in my mouth it tasted like fungus, so it's called dysgeusia, or I may not even be pronouncing it correctly, but I had this awful taste in my mouth the whole pregnancy, and I was just disabled just from sickness the entire time. And everyone tells you, oh, you'll lose your energy when you give birth, but I had more energy. And in these last 12 years, I felt my best in the first few months after giving birth, which happened to be during the start of the pandemic. So I thought of, when I knew I was disabled, I knew I had a ripped hip, but I was do I do surgery first, or do I have a kid first? And I knew I was, aging, and my hip, I was deteriorating. So, we made the plunge into it, and we ended up conceiving the final month that I was going to stop because I had felt my left hip starting to hurt, and I was just like, I knew I couldn't do it. I even told like one of my best friends, I was like, yeah, Jay and I were stopping after this month because I just can't do it anymore. And then I got pregnant. So it's like, it's really weird because there have been things in my life that have happened like that are just so profound that seem so coincidental, but not. And I'm really, really lucky for that 1 month difference to now be a mom. And that's why really I'm doing all this fighting now, because I had done my skin picking advocacy work and everything while this has been going on and trying to, improve it. And I've just been held back by my own disabilities because chronic pain takes so much from you. It's like another job in itself in your mind. Like all the things you have to do to like even map out in your mind how it's easier to get from point A to point B, how many steps you'll have to take. Then you have to like go through the stress of, oh, I have to get up. So therefore the pain in your hip or wherever is just aggravated, especially if it's in your lower extremities. So I've had a lot go on that kind of may be the result of chronic pain now that it's been 12 years, including cancer, my recent cancer diagnosis, which fortunately I found out that I have cancer had cancer on the same day that I found out that I no longer had cancer because it had been removed. So I can never actually have said I have cancer because I was waiting for the biopsy result came back a follicular neoplasm because I had a huge growth here just in this past year that was developing. And then that one was actually benign. I had 3 others that were small and 2 of them were cancerous.
They removed them before they had the results of the biopsy?
Well, the biopsy came back as a follicular neoplasm, which could have been cancer or could have been benign. So the only way they could really find out was to get the lab results and investigate the whole thing, because apparently, it's something like about the capsule, it needs to be intact in order for some biopsy results, not all. Like I thought I've been waiting weeks for the biopsy result. Come on, is it cancer? Is it cancer? Or is it not? And I was told it would be inconclusive. It would be cancer or not cancer. And then it came back this other thing. And so we had to wait, until the surgery, and then had to wait a couple weeks after that to find out. But actually, when I was pregnant, my chronic pain went away. So that's why I felt so good after. It was weird. It happens to just a few people, but the way my body handled the pregnancy hormone and being so sick anyway, I mean, at least there was like one upside to it. So the pain, my body felt okay, but I was just so sick.
You should just get pregnant again. Just stay pregnant all the time.
Well, the thing is, when I was I had to get a C-section because of all this. There was like no way that I could give birth naturally. And I had said during every single appointment, she's like, "Are you sure you want to have your tubes tied?" And I'm like, "Yes, I want them cut. I want them burnt. I want them stomped on. I want them whatever." And you know what? Now that I am a mom, I wish I definitely could have had more. And but only under the circumstances that I could provide more, because with the amount of pain I'm in and trying to manage it, especially with it affecting my mobility, I need to be able to give more to my daughter that I can't. And if I can't get help and I'm just being left like this, I was in that situation with the piriformis syndrome in 2018 where I was pretty much abandoned here in Nova Scotia. There was nothing that could be done in Canada. But I had thought when I had a kid, I was like, okay, I can get my hip done here in Nova Scotia. I'll never have to go through anything like this again by having to seek help outside of the province, because it's just, everyone gets hip surgeries done. Like you always hear about someone's grandma getting their hip done, or I didn't expect the mess I would be in and why I'm in it, and I don't even know what to do next after everything.
So what is your diagnosis now, and like what Is there anything that can be done, or there is, but the health system is just failing you?
Well, there is a diagnosis and there isn't a diagnosis. Technically, in Nova Scotia, I went to get a second opinion because my original surgeon told me nothing was wrong with my hip after he tried to make me wait over 2 years for an MRI. And when I finally got the MRI, I had to go through the private system and pay over $2,000. I got the results mailed to me, but they ended up coming to me the day after my appointment with him. He told me nothing was wrong, but in fact, when I got it in the mail the next day, it said that I had a large anterosuperior capsular defect. So I've never had it really fully explained to me, but essentially in the surgery, the last part of the hip surgery that they did for me, they did something that surgeons have only been doing in the last 10 years called a capsular closure. So for whatever reason, that didn't close and it's torn. So my entire hip around my hip joint the second opinion guy did say that it would be like instability, like my hip rattling around. I'm like, that's exactly what it sounds like. But he said during the MRI procedure that the technician must have put too much dye in it to make it look like, which makes it appear like it's a defect. So that's why I got the referral to go to Ontario through their public system. But I've also been frantically fighting with Canada's private system and got denied right away with my first email to one clinic. And another clinic I've been working with and submitting everything to since October. And they closed my file because just as I was going to have the appointment with the arthroscopic surgeon, I had to cancel because I was like, what? It's an arthroscopic? I want hip replacement. And now I've learned that there's no surgeon, at least in Canada, but it doesn't even sound like in the States or anything. They do one or the other. Arthroscopy surgery, which is less invasive, and then there's hip replacements that people get. The second opinion guy ended up diagnosing me with chronic regional pain syndrome, saying that the pain didn't switch off after I had my surgery and that it looks fine to him. And then he said he spoke with 3 radiologists who all said that the defect is real. So I asked, what was it about their opinion? Like he said he sat and talked with all of them. So what was it that, convinced them that it was real? And he couldn't really give me any tangible evidence. And I hate when doctors, and I don't like the lack of intellectual curiosity. Like you see when you watch shows like House, like even if doctors are disgruntled or whatever, that they're still interested at least in what they're doing, even if they're not interested in you as a person, to investigate that. So I don't know if the next arthroscopic surgeon is going to go like, yep, this is, and like I don't know what happened with the other people. And why I can't get a hip replacement, even through the private clinic, because that's what I asked them. They reached out to 2 surgeons, and they both said I wasn't a candidate. But the second one, apparently through the private clinic, had advice for me. He said, what the surgery you're going to have to get is going to be pretty much so invasive and severe that you should get it done in your home province. Like, hey, can I get an appointment with you so I can tell you my whole story and tell you why that isn't possible? I'm so scared that even if I do get surgery in Ontario, in Hamilton, that when they open me up, that there's just going to be so much damage from whatever the capsule issue, the defect issue is, that I'll need a hip replacement. There's already arthritis in there, so they probably shouldn't be doing arthroscopic surgery, but a lot of people in forums I've seen have had to go through so many repairs, and I don't want to have to keep going through repairs. I certainly don't want to go through a repair if I have to pay for it with such a low recovery rate, especially because I've been disabled and my muscles have been deconditioned for so long. But that's where a lot of the gaslighting comes in too with professionals, where I need to be doing physio. that's what the advice I've been given by, and of course, I'm not downplaying the importance of physio and being able to like strengthen muscles around it, but everything that surrounds my hip is so sore. Like I can't do any core muscles unless I just like sit up in the chair and just flex my core muscles. That's it. And so the health system just keeps failing over and over and over. So this health like nightmare didn't start like because of the pandemic. I mean, the pandemic exacerbated everything, including like homelessness and a lot of economic issues, while the top 1% just like raked in the rest of us. But it's really, I don't know what to do overall if I can't get help with all I've gone through, because there's no more going to the States. There's no referrals now that say this person's been in chronic pain for 12 years with blah, blah, blah. It's just like issue based. Like, for example, like the guy who I'm waiting for to see in Ontario, I'm pretty sure he only has the information that, oh, I had a MRI result that you need to look over again, and MRI just for your second opinion. It has nothing to do about my whole history or my quality of life. Nothing. None of that matters. The coldness and even cruelty that I've experienced by a lot of professionals over the years, and even discrimination. I've had more discrimination from healthcare professionals than the average person when I talk about things like skin picking, when I talk about like anything mental health related. There's such a disconnect. And I don't understand, other than it possibly being like a class issue, since a lot of doctors are in more of an upper class and have a lot of more old school ideas in comparison. Of course, younger professionals I have found all around are overall better than the older ones in just how they deal with people, because I really believe in the younger generation. The ideas, the compassion, the acceptance that, at least here in Nova Scotia, that I've seen, you know, from professionals, I've really appreciated it in comparison to like the older ones. And certainly even like the higher up you go with specialties, I find the colder they are. I mean, there's a lot of professionals that, you know, maybe they do go into it like because they care or whatever, and maybe they're numbed because there's a lot of pain they have to experience with their patients, whether or not it's their fault. I mean, I can certainly understand a lot of that, but they don't go searching for answers the way that you see, like again, using Dr. House as that example. But I can tell you now, with being in the amount of pain
that's fiction.
Yeah. With being in the amount of pain that I've been in for the last 12 years, except for like my pregnancy. But I certainly can't watch that series again, because last time I watched it, I wasn't in chronic pain at all. I just started dating my boyfriend, who's now my husband, because he owns the series, and the amount of pain of what they show of Dr. House and how relatable it is, I don't even feel like I could certainly watch that anymore.
I've never seen the show.
Oh,
so he has chronic pain too?
Yeah, and he's a crotchety old guy. He's addicted to painkillers. Okay. He's really it wouldn't be deemed acceptable actually in like 2020's culture. Be a lot of misogynistic type jokes, I'm pretty sure there's racial jokes towards one of the characters, and so like it goes on. I actually think you would really like it.
Could be. I can only imagine having chronic pain and having to deal with the mental part of it as well. So how is this affecting your mental health, and like how's it affecting your relationship and just all of that, kind of that end of it?
I felt invalidated, and that left like this different type of hopelessness, because I had to explain to doctors and people that I was disabled. I wasn't getting any type of benefits. I didn't have like a real diagnosis for the longest time. I was just sitting around in pain and didn't understand trying to sit around in pain, but having issues sitting on my left side, and among other things. So I felt like, as a partner to my then boyfriend, I felt like I let him down. I let myself down. I was a graduate from child and youth care and addiction support program and was just wanting to start my career. And I haven't been able to work since because of all this. So he's taken on the financial burden, and it's not easy getting by if pretty much anybody anymore, unless you're in the upper class. And so to be invalidated also by professionals, to be told to do things that make my pain even worse, to be devalued and looked at as strange, because I know I'm not the most expressive person, and I've figured out really through all like my skin picking advocacy and whatnot, I don't have a diagnosis, so I don't want to be irresponsible with self-diagnosing, but I do believe I'm autistic. I just have a lot of mannerisms, and I believe skin picking was a huge part of it for coping mechanisms and emotional regulation. So, and I mean, I've been in so much pain. I even went to the States in 2016 because I was invited on a TV show to help with my skin picking, and it was pretty amazing for a while. And my recovery's still good, but I mean, my eyebrow I just like tore apart, and under here I've been having issues on my cheek. So
you've kind of started picking again recently, or?
Well, in the last couple of years, for sure. Like it comes with the hopelessness. It comes with being tired, not being able to sleep. So not being able to maintain general mental health has an effect on how my brain, or how anyone's brain in this much pain, reacts. Like the quick reaction when you're like this, and that's why things like meditations are important and helpful in calming down your central nervous system, but it can only do so much when you're not sleeping at night.
Bunny Hugs and Mental Health is supported by Co-op. I've been a member of my local co-op, Sherwood Co-op, for about 20 years. If you live in Western Canada, especially the prairies, or spent any time here, you've probably fueled up or bought groceries at a co-op. You might even have a co-op number, or 2, or 3. You know if you know. But Co-op is not just a gas bar or grocery store. Although Co-op is those things too, it's a different kind of business. Co-op members are owners, and success is shared with everyone. Your co-op doesn't benefit one person or one corporation. Your co-op was built for everyone. Your co-op was built for your community. Learn more about Co-op and find a location near you at co-op.crs.
Introducing the timely children's book, Sometimes Daddy Cries. The visually stunning book is told through the eyes of a boy whose father suffers from depression. He sees his dad get sad, rest, and even go to the hospital, all while comparing his father's depression to a physical ailment. Sometimes Daddy Cries is getting rave reviews from parents and mental health professionals alike. One critic has stated, "This is a timely and important book that will help countless fathers and sons broach the subject of depression." An Amazon customer commented, "An excellent book to open up a conversation with a young child about depression in a parent." Sometimes Daddy Cries is available in hardcover and paperback on Amazon.ca and Amazon.com.
And you're on medications, and you're just trying to get by. And like just doing household chores is a nightmare, having to put away dishes and take them out in intervals because of pain. Like, I haven't been able to vacuum, and so I feel like less of a partner, especially in the last couple months. I had to give up sex because there's no possible way anymore. I mean, tried, and not even for like a few seconds anymore. Whatever's happened in my hip, it's pretty destroyed, and I'm going to have to keep paying for that when doctors, like I said, even if this next doctor, the last option I have, if he opens me up, and it's just, sorry, just give me one sec.
Yeah, take your time.
Uh,
I can only imagine the frustration because, like you kind of said, like you don't even know what doctors, what info they have. So
yeah.
you go to a doctor and you're thinking, okay, this time, and they're only looking at your last MRI. They're not even looking at all your history. And oh man, and then being like I too don't really work much because of my mental health issues, and so I kind of relate with some of it, but there's no chronic pain either, right? It's all mental health stuff, but the feeling of invalidation, feeling of them saying it's all in your head when it's not, the feeling
I
of
even like
guilt
told
and shame.
I told one of the professionals that I went to the States to have my piriformis muscle removed, and he just said to me, "Oh, anyone can just go to the States and get anything removed and feel better." And I'm like, thinking, "Are you kidding? I
What?
just finished having a surgery that didn't make me feel better." Even though, to be fair, it did make me feel better in one way. It fixed one issue, the labral tear, but then I felt like a
Mm-hmm.
whole new issue started in my hip.
Right.
So
Yeah,
it felt like
exactly.
just altogether like a new issue, and I made that very clear like from the beginning, but it wasn't investigated,
Mm-hmm.
and then so on and
Right.
so forth. But yeah, like the
But yeah,
certainly not
and
to
then the shame
invalidate.
and guilt.
Yeah, certainly not to invalidate because you go through, mental health issues that disabled you. I certainly went for a few years like disabled in my early 20s and late teens where I just dropped out of college and I couldn't do anything. That was the time that I was picking my from head to toe like and from all hours of the night. I remember it was like 11 p.m. to 7 a.m. when I had to give my cat his needle. I was in the bathroom. I'd start at my face and go all the way down, and then it was like things would settle and then I would have to look at things again and search and try to, and so I was stuck in like the cycle so badly. So I
Mm-hmm.
certainly don't experience it the way I do now, but I still see
Right.
things and that need to be quote unquote my mind interprets as fixed because it's
Right.
reading
Right.
it as like a threat to myself, that like just like the flight or flight danger actually turns on. And that's why it's so
Right.
hard to stop yourself, because it's not about willpower. It's about finding ways to minimize that fight or flight and to even recognize that something isn't a threat. And that's like a
Mm-hmm.
huge key part that I've learned with my skin picking therapy. But unfortunately, without being able to maintain my own mental health, without being able to maintain my guilt, like this was all supposed to be done when my girl was just little. I and now like I can't walk her to school when she starts in September. I
Mm.
it everything's being taken from me. Everything's being
Do you
taken
mind
from
me?
them, my family.
Do you mind me asking how old you are?
You want to take a guess?
No.
No, I won't put you through that. I actually just turned 38 2 days ago.
Yeah, I mean, when you're 38 years old, these are all like issues you should not be having to worry about for the last 12 years.
Yeah.
Uh, and yeah, you should be enjoying your young family. Or, I mean, everybody has something, but to be in chronic pain and chronically invalidated, that feeling of shame and guilt that you are, well, it's or the feeling of being a burden to your husband and to your kid, and this is, I my heart goes out to you, and like I said, I relate ish, I mean, on a very smaller level, but I can only imagine the beyond the chronic pain, the mental anguish that you're going through as well.
Thank you. I really appreciate that. And it's especially frustrating because I know that someone can help me. It's just a matter of when and
Right.
going through all these systems. And
Yeah.
when your last option is being on strong medication, just waiting for help, your chance of becoming addicted, dependent, even overdosing can increase. I can't even go down to the basement because that's too many stairs. The stairs are a huge trigger for me, so I haven't been able to go down to his lair for a long time, and maybe it's for the best.
Who knows what's down there now?
Yeah, exactly. We'll just leave him be down there. I've been
Oh
so
man.
lucky. to have him. We just celebrated our 10-year wedding anniversary the other day. Like, when doctors didn't believe me, he didn't have to believe me either. He could have been like, oh, look at her just trying to live off me, trying to, he could have, but he saw the pain, he saw the anguish, he saw everything. He's experienced so much from this. So everything that's taken away from me is taken away from him. It's taken away from my daughter, Violet, where I have to tell her to be careful when she jumps on me, to not touch my boo-boo, and that she asks, when is it going to get better? And she hopes it's going to get better soon. And I don't even know, like, when we're playing doctor, like when I'm trying to use like the little doctor set, I get like so wrapped up in my own trauma. Like, how do I tell her, oh no, honey, you don't just go to the doctor and get help. You go to the doctor and then wait a year for a scan, and then wait 2 years to actually see the professional. And then they'll look at you and tell you that the pain's in your head, and so on and so forth. Like, and that, like, all the commentary in my head that I have to, and I literally don't know how to even like play with her when it comes to that. But on the horrible end of things, it's like, now that we're getting into the summer weather, which I love, especially now that I'm more comfortable wearing shorts because of my skin picking recovery, I can't take her to the park. And even if I'm like driven to the park or something to play with her, it's like I want to interact, I want to chase her. I'm not like the coddly mom. I'm the rah and like wanting to chase her around. And it's so much to put on them, especially though, like, again, the stuff my husband has to do. He has to do like the kitty litter every night. He has to do laundry. He has to do, because I can't do the stairs anymore. And now that I've been like giving up vacuuming, because it's just like it broke down to like doing the top floor, and then it was like, well, I'll do a couple rooms at a time, and then I can only do one room in one day, and now it's just like I can't. But again, it's all my fault because I'm not doing physio right now to keep up to, which, I mean, you have to have private insurance, which I'm lucky to have, but that's still the expectation that I'm going to physio right now to keep up my strength and everything, when I'm in so much anguish that it's like I can't stand long enough to have a shower. I have to do it the old shower head type deal. Like, I feel like I have to give a warning to young people getting hip surgeries that if it fails, that there's a possibility you won't get it fixed ever again. Because I don't know what this is. I don't know what these games are. But I could have gotten the MRI without the dye to confirm it. But maybe if it was confirmed, then someone would have been forced to have to deal with it here. There's, I hate to say that. I hate this. But how did this happen? I've fought so hard to get this far.
It's that time again for that Some Bunny special segment where we chat about who cooperated in your mental health journey and helped fill your emotional tank. Brought to you by Co-op. The wonderful Co-op. Thank you so much for this. I have a Co-op number, and it works really well. And every once in a while, I get a dividends check from Co-op, and it's amazing. It's all membership owned. Anyway, this week I'm gonna answer this question. So I have to say, someone that helps fill my emotional tank are all of my guests that I speak to every week. I've become friends with many of them. They are huge supporters of me and my continuous mental health journey, and I can't thank them enough for being so vulnerable and open and telling their stories so that others can relate and know that they're not alone. So thank you to all my wonderful guests that have ever come on the show and told their story. It's so very much appreciated. By telling your story, you are affecting so many people's lives. You can't even imagine how many people are listening and getting stuff from it, or at least passing it on to other people who might get something from it. So thank you so much. It's so much appreciated, and I'm just so grateful. Do you think sometimes it's just shit luck for whatever reason you're getting? You just happen to be seeing the doctor on a bad day or whatever, because I mean, why aren't other people seem to be going through this? You know what I mean? Do you get a lot of like, why me?
I do feel like that. I don't know. I certainly feel like the why me all the time because of this. And I hate feeling that way, that helplessness. Like, who else is actually
Yeah.
going through this? But I do have I do have a lot of friends who have gone through like very traumatic experiences. They've gone through long waiting lists, but they have been able to get their issues resolved. It's just on the way there.
Right.
It's been a long journey for them too. So
Are they in Nova Scotia as well?
yeah, a lot of Nova Scotia people.
Okay.
Yeah.
Okay.
That have had long.
Like, I wonder if it's just your province that happens to be
well, our
particularly
province
shitty.
is one of the worst. I have right now on my TikTok at Angela Hartlin a video pinned with a lot of facts about Nova Scotia. We are like one of the worst when it comes to wait times for specialists, when it comes to not having family doctors, which I'm lucky to have one, but a lot of people don't. I think the percentage was like 14% of the population doesn't have a family doctor. If I didn't live with my husband, had we not worked out, had we not already been in a solid relationship and things been good, if he tossed me aside, I wouldn't have made it through all this. I would have never been able to get the piriformis syndrome surgery. So I know I've gotten this far because of other people, not like who
Right.
even financially. Even when I did the GoFundMe back in 2018, which I'm never going to do again because I feel like that was my chance, So I'm never going to do because there's so much going on in the world too right now that's just too traumatic that like everyone's quality of life has gone down since the pandemic, except for the 1% who have more money that they don't even know what to do with.
Well, they're flying around in rockets.
Yeah, that's true.
For shits and giggles. Yeah. Because as you're talking, I go to the negative right away. And my thought process would be like, okay, so my husband's amazing and my kids are amazing. Like, what am I bringing to the table? Like, why is he staying with me? Well, like, what is, I mean, I understand he loves me, but what am I bringing to the table now? Like, I've
still asked him that. Yeah. I've asked him, like, what is it still? Like, is my fight worth it? Is it worth it for me to keep fighting through this? Or is it better that I
know.
Mm-hmm.
Yeah. I know what you're saying, but I don't.
So it's sorry, what?
But that's our mindset, right?
Yeah.
I was going to say, but that's our mindset. Like, obviously you are bringing something to the table. Otherwise, I mean, of course my brain always goes to the negative. It's like, I'm the burden, I'm to blame, I'm this, I'm that. But so I mean, I don't want you to think that, but
he and I connect so well, like, where I can just totally be myself around him like I've never been able to with anyone, and just let like all my silly go, let everything, tell him absolutely everything. And he's always been so accepting and loving and supportive, and of course he's hot. I mean, but like it. So I mean, I'm kind of lucky in that superficial way. But no, we have something for each other, and I'm glad that he was still able to see that and that it didn't slip away as my mental health declined. I wasn't depressed when I met him. I was finishing up college and I met him and we moved in together and things were great. But at this point, all I have to do is just keep doing what I'm doing. But then there's also issues of discrimination now with my face looking the way it does again, and now being on medications. I'm fine. Doctors can finally treat me like the addict that they've been treating me for years like. Or not taking me as seriously, because we know that there's extreme biases in the medical system which affect, so many different people, like people in the LGBTQ community, people of color, people of different religions. I mean, people with mental health issues, people ageism. There's even a lot of issues when it comes to women, how women are in pain are treated versus how men are treated. So being a woman in pain with mental health issues, especially somewhat strange mental health issue as they consider it, because skin picking didn't really come out until I helped bring it out into the open. as one of the first.
It's hysteria.
Yeah, yeah, exactly.
Yeah.
And I mean, yeah, if you look at the history of like institutionalization and whatnot, and how women were treated, a lot of issues were attributed to things like hysteria. And but some, like, I'm kind of like a case like, oh yeah, so all this pain could be in her head. And I wish doctors and all professionals would realize that if they can't figure something out about a patient, that to again have that intellectual curiosity to even open up their minds and think something else could be going on with her other than what we know. It doesn't have to always go. Like, even well-meaning professionals have said things like that to me, or have treated me like the piriformis stuff or hip stuff, like maybe possibly in my head, just like I guess the second opinion guy does with the chronic regional pain syndrome. That it's my brain not, disconnecting. What if it is chronic regional pain syndrome? Then what? This is it anyway.
Like, what does that even mean? That sounds so vague. It's like, you have chronic...
it's like it's almost like, so I don't want to say because I don't want to get it wrong, but it almost sounds like it's similar to fibromyalgia. So in the sense
like you have chronic pain in this area disease. What the hell does that mean?
Exactly. And like I've learned like so much, like there's so many different things that X-rays don't pick up, but MRIs don't pick up.
I that was something I wonder too. Like, are you blacklisted? Like, I don't know. I think of that Seinfeld episode where it's like Elaine was difficult or whatever, so that she was going to different doctors and eventually she goes to a veterinarian. But yeah, and the other thing that drives me nuts when I hear stories like this, it's like because you hear people being on waiting lists all the time for things like MRIs or whatever, and then you watch like hockey or football and someone gets injured. And like within 20 minutes, they're like, the announcers are giving, the diagnosis because they have an MRI machine right in the rink or in the stadium or whatever. It's like,
yeah, the class
the 1%,
difference.
I guess.
I would still be waiting for that MRI right now. I would be waiting for that hip MRI right now if I didn't pay for it through the private system last year. That's how bad it is right now. And I wonder why me, but I also wonder, like, how many are like me? How many are waiting for years? How many people are paying all the taxes that we do into Canada's health system to get nothing? Like, when you wait 2 years for a scan, you've already waited so long. You've already paid taxes for a couple years. For what? Nothing. You get nothing. And that means, and then again, you have to wait for the specialist after that, and then you have to wait if you need surgery for surgery. So you could be like waiting a good 5 years to get one thing disabling fixed. And then if that doesn't work, then you have to wait again. Or see somebody else and wait to see them, and then wait for a surgery for them, and it's never ending. They think pain can last forever, and I don't think it can, because I think I've been in pain so long that it's probably caused, again, my thyroid cancer, and it's probably caused, like, also dealing, like, having to medication management has probably caused this as well, and just trying to live like this every single day. So, yeah, I think chronic pain can, when I knew I was going to talk to you, I actually pulled up quite a few stats that I wanted to share, if that's okay.
Sure, yeah.
Apparently, chronic pain is the #1 cause of disability and disease globally. And people with chronic pain are 3 times as likely to develop depression and anxiety. That's from Harvard. 5% of the population has depression. I would kind of venture to say a little higher. But up to 45% of those living with chronic pain have depression. And people with chronic pain are at least twice as likely to think about, attempt, or die by suicide.
It's all in your head, though.
Yeah.
So
I need someone to take me seriously, and I don't know how.
When you were saying those statistics, too, the one that came to my mind was how many people with chronic illness are also have addiction issues. Because when I worked in addiction, I know lots of people that went in for surgery or some kind of procedure and got hooked to painkillers.
Yeah.
And then once they got those taken away or whatever, then they started finding them on the streets and whatever else. And
that scares the crap out of me. Like, I mean, that puts the doctor in full control too of essentially your life. Like I can't walk without medication at this point. I would just like crumple onto the floor. That's how bad it's gotten this year. I like I've heard of stories as well where like people, they get surgeries and they're only on it for like 3 weeks and boom, they're addicted. I don't know if I'm addicted. I'm not feeling like I get any shakes if I don't take it, but I'm in so much pain. I'm taking things regularly because I have to like for the sake of mobility. And
Right.
yeah, so that even if I get through all this and finally get off all the medications, it's like, am I going to have to go through some type of detox? Is it going to be just like, I mean, I don't want to minimize certainly the effects of going through addiction, but I would be glad if I can get to that point where I need detox. I'd be glad to get to that, but I don't know if it's exactly something I need because I don't feel like compelled to it. I'm just like, ow, I'm in so much pain. I need that relief. It's not like, oh, I need a high. So I don't know about the dosing or anything. But yeah, I also don't know if I'm ever going to get cut off.
It's like your best case scenario is I'm addicted to painkillers because that means the pain's no longer there. Like that's pretty bad when you're best case scenario. You're hoping for addiction because that means the other thing's been fixed.
Yeah.
Like that's,
well, just like
that's
I was,
so twisted. I mean, it's weird. Thank you so much, Angela, for taking the time to speak with me, not just once, but twice. I hope things are looking up. It's been a little while since we talked. You never know when something good might happen, so hopefully by now something good has happened and you're receiving treatment and a diagnosis. Thank you so much to Co-op for sponsoring this episode and this podcast. Always, always, always very, very appreciated. I mean, you would be listening right now if it wasn't for Co-op, so thank you so much for them. And thank you for listening. Please rate, review, share, do all that kind of stuff. Let other people know about the podcast and about the amazing guests that I have that are advocating and being vulnerable and putting themselves out there so that other people can relate and maybe find some help as well. So until next time, please remember to make your beds and take your meds. Bye.